Okay, welcome back, everyone. Good afternoon to you. I hope you continue to do well under these challenging circumstances. Okay, we're going to hop right into chapter 13 today, which is the defense and immune system chapter. There's lots to do, and expect that this coming Monday, I will be releasing a study guide for your third lecture exam. Okay, so we're moving pretty rapidly here, and I would ask that you please try to stay as focused as you can because we are going to be coming up with some exams and things as we finish this semester. If you can hear me okay, please type yes into the chat window. Okay, wonderful. Okay, good. Thank you very much. Okay, before we get started on new content, do you have any questions at this time? Anything that you want to ask about? Okay. All right, folks. Well, then let's jump into chapter 13. Chapter 13 is one of my favorite chapters because the immune system is a fascinating aspect of your body. So bear with me. I'm going to share my screen and I'm going to bring up a Microsoft Word document so that we can take notes. Okay. So if you have any problems or you need me to slow down, please type into the chat window or please unmute your microphone so that you can ask your question. Okay, so chapter 13 starts basically on page 240 and 241 of your textbook. The topic of chapter 13 is body defense. Okay. All right, so before we can talk specifically about body defense, I need to define two terms for you. Okay, the first is pathogen. Okay, the term pathogen refers to any disease-causing organism. They're typically microorganisms like viruses and bacteria and fungi, but they could be larger things like parasitic worms, okay? So a pathogen is any disease-causing organism, for example, viruses, bacteria, fungi, protozoa, parasitic worms. Okay, these are the typical examples of things that would be pathogenic, things that would cause disease in our body or in, your dog's body at the house, or if you have a cat, your cat's body. A pathogen is any disease-causing organism. A related term is antigen. Okay, now we've encountered the term antigen in the blood system chapter when we talked about the ABO blood types. And we said at that time that an antigen is anything that activates the immune system, and that's true. Okay, so an antigen is a molecule that activates the immune system. In other words, the immune system feels threatened by the molecule, so the immune system activates and begins working to defeat that antigen. Okay? Typically, an antigen is a molecule that makes up a piece of a pathogen. Okay, typically an antigen is a molecule that makes up a piece of the pathogen. Okay, so for example, with a pathogen right now, certainly, we've given you some examples, but certainly the current coronavirus that's circulating around the globe, causing a lot of heartache right now, that is, a perfect example of a pathogen. Okay, and so there are molecules on the surface of the coronavirus that are actually antigenic, which is to say the host immune system sees them as dangerous, and so the host immune system activates, turns on, and begins to fight the coronavirus. Okay, unfortunately, not always successfully. Okay, proteins and lipid molecules that make up the coronavirus. Okay, gang. Do you have any questions about those two terms? Okay. Now, in terms of body defense, which is the topic of this chapter, body defense is typically talked about as 3 lines of defense. Those 3 lines of defense are shared with you on page 240 of your textbook in the top left corner. Okay. There are 3 lines of body defense. Okay. 3 lines of body defense. All right. So you have the first line of body defense. This is known as the physical and chemical barriers. Okay. The physical and chemical barriers are things that are non-specific, meaning that the barriers don't know what they're protecting your body against, but they're simply providing some defense for your body. Let me give you a few examples. Okay. An example of a physical barrier. Well, I think you can appreciate that your skin would be an example of a physical barrier, right? Your skin is the outer border of your body. It provides a protective coating, covering to your body, and it prevents a lot of microorganisms in the environment from entering your body. So there's a physical blocking mechanism. Just like whatever room you're sitting in right now to participate in the lecture today, that room has walls. Those walls are physical barriers to things outside that might want to cause you harm. In a similar fashion, your skin is a physical barrier. Okay, so it blocks external microbes from entering the body. Another example of a physical barrier would be mucous membranes. Okay, now you have mucous membranes throughout your body, but for example, the mucous membranes in the respiratory tract. Okay, so you have these mucous membranes in the respiratory tract, and every time you inhale air, any dust or microorganisms that are floating in the air that you've inhaled, a lot of times they will be trapped, they will be caught like a catcher's mitt in those mucous membranes. And then you can either sneeze that material out of your body, or other times you will actually swallow that material out into your stomach, where the powerful digestive acid in your stomach will destroy the material that you swallowed. Okay?
I do have a question.
Yes.
Can we consider eyebrows and then the hair in our nostrils as barriers?
Yes, you can, Terry. That's another good example. Let's put those down. Okay, eyebrows protect your eyes from having material drop into the eye. We could also mention your eyelashes, right? Eyelashes are going to do the same thing. And the hairs inside your nostrils. Right? All of these things are physical barriers to prevent things from potentially causing you harm. Okay, so hopefully these examples help you appreciate what we mean by simply physical barriers. Okay, let's talk about chemical barriers. All right, so for chemical barriers, we can also mention the skin, but not the skin itself, but the oil that's present on the surface of your skin. Skin oil, okay, the oil is a chemical, it's on the surface of your skin. Okay, as you sit down at your computer right now, go ahead and just rub your fingers back and forth across each other. You notice that your fingers tend to smoothly glide across each other. That's because you have a very, very thin layer of oil covering the surface of your skin. That oil is protective for you. It helps to keep the moisture of your body and the moisture of your skin inside so it doesn't evaporate too rapidly. But the chemical nature of the skin oil is actually a protective mechanism for you because the pH of the skin oil is mildly acidic. Okay. So the acidity of the skin oil has antibacterial properties. A lot of species of bacteria that might want to cause you harm, they actually don't like to live on the surface of your skin because of the acidity of your skin oil. Now, of course, there are some notable exceptions to that, right? Nothing is bulletproof, nothing's 100%. You know, there are some exceptions of microbes that can survive on the surface of the skin, and one of those would be MRSA. Okay, MRSA is a bacterial infection. Does anybody know what MRSA stands for? I'm going to type that into the chat window here. Can anybody tell me what MRSA stands for? What does the acronym MRSA stand for? I mean, if you work in a hospital setting or a nursing home setting, most certainly you've encountered that phrase MRSA before.
Is it methicillin-resistant Staphylococcus aureus?
Yes, it is, Terry. Thank you very much. Very good.
I'm impressed that I said it correctly.
Okay. Methicillin resistant Staphylococcus aureus. Okay. Methicillin is a type of antibiotic. It's a category of chemical. Okay, so we're saying that you have Staphylococcus aureus, which is a bacterium, which is resistant to this class of antibiotics, which is referred to as methicillins. Okay, so that's one of the nasty guys that unfortunately is an exception to living on the surface of your skin. Okay, other chemical barriers. Well, let's think about it. Your saliva. Okay, your saliva is certainly a mixture of chemicals. So the saliva is a mixture of chemicals that have antimicrobial properties. Okay, antimicrobial properties. As an example here, in your saliva, there's a whole bunch of different kinds of chemicals that your body manufactures, but the one I'll give you right now is a special enzyme called lysozyme. Saliva contains lysozyme. And what's significant about lysozyme is this is an enzyme that has the ability to break down the chemistry of bacterial cell walls, and by doing that, help to destroy bacteria that might cause you harm. The chemical within the bacterial cell wall is called peptidoglycan. Don't worry about that too much, but I'm just telling you that's what it is. Okay. So saliva contains lysozyme, which has the ability to break down the peptidoglycan component of bacterial cell walls. Okay. All right. So this is just a couple of quick examples of chemical barriers that your body uses to protect itself. Do you have any questions at this time? Okay, let's keep going then. So the first line is fairly straightforward, and I illustrate that with a couple examples that I've given you. Let's go on to the second line of defense. Okay, the second line of defense. Okay, this one is made of a bunch of things that we group together, and it's made of defensive cells, defensive proteins, a process that we've all experienced at some moment in time called inflammation, and a process that we've all experienced as well called fever. All of these things together are in the second line of defense. Okay, we're going to talk about each one of them at a time. Let's talk about the defensive cells. Okay, now you remember from the blood chapter that we defined some of the defensive cells for you. Remember when we talked about things like neutrophils and eosinophils and things like that? Those are examples of defensive cells. But let me give you a few more examples. Okay, phagocytes. Okay, a phagocyte refers to any kind of cell that has the ability to perform phagocytosis, which means taking in and kind of chemically eating a microorganism to destroy it. Okay, any cell that can eat a pathogen. All right. Now, you see an example of that actually on page 241 of your textbook, figure 13.3. If you have your textbook available, please kindly open that up to page 241, figure 13.3. And what you see there is a giant macrophage, okay, that is extending part of its cytoplasm down towards the bottom of the photo to reach out and grab that brown little cell that kind of looks like a turd. That brown little cell that looks like a turd is a bacterial cell. And so the macrophage is going to take that bacterium inside itself and digest it and destroy it. And that is what phagocytosis looks like. Okay. So, when we talk about phagocytes, there's a variety of different kinds of phagocytes, such as neutrophils, right? Neutrophils have phagocytic ability. We've talked about those before. Macrophages, which is the topic of figure 13.3, those are types of phagocytes. Okay, all of these kinds of things do have the ability to destroy the invaders. Now, another category of defense cell is your eosinophils, which we also mentioned briefly in the blood chapter. This is a type of white blood cell that has the ability to attack parasitic worms. Type of WBC, white blood cell, that can attack parasitic worms. All right. Now, most of the cells we have on the screen right now, you've heard of before, but here's a new word, a new kind of cell that we haven't put into your notes yet, and it's the topic of a natural killer cell. Okay, natural killer cell as a topic begins on page 241 of your text, and if you turn to page 242, you see figure 13.4. Okay, 13.4. Natural killer cells are a type of white blood cell that go out and they attack abnormal human cells. Okay, so the critical word here to understanding what I mean by a natural killer cell is that we have to appreciate what abnormal would mean. How do we define abnormal? Well, in the context of our conversation, abnormal is going to refer to cancerous cells or virally infected cells. Okay, so you can bet that anyone that's unfortunate enough to have a coronavirus infection at this time has an elevated white blood cell count of natural killer cells, because their natural killer cells are going around the body trying to identify cells of that person's body that have become compromised by the presence of the virus. And those natural killer cells are trying to kill the cell that's infected, so that cell cannot be used to manufacture new coronavirus. Okay, and again, figure 13.4 in your textbook shows you two artificially colored natural killer cells that are orange, and they're attacking that artificially colored cancer cell in red. Okay, so it's important that you appreciate that every one of us sitting here in this conversation today has abnormal cells in our body. Every one of us has cells that aren't functioning properly. Every one of us has cells that are pre-cancerous floating through our bloodstream at this time. And for most of us, we will be blessed that the natural killer cells find these abnormal cells and destroy them before any significant disease can develop, which is why many of us will be blessed to live into our 60s, 70s, 80s, and maybe even further, because the natural killer cells are doing their job properly. Okay? Think about it. We have, at this point, how many people do we have on planet Earth? A little over 7 billion, something like that. And isn't it certainly guaranteed that in 7 billion people at any given moment of a day, there's probably a few people around the world that are upset enough that they want to do something very antisocial. Well, if in 7 billion people on the planet, we have a few people that are going to do dangerous things to hurt society, doesn't it make sense that if your body, which is made of way more than 7 billion cells, maybe 70 trillion cells, doesn't it make sense that within your body that there's also going to be some cells that are probably not functioning properly for a whole variety of reasons? And we actually need police officers, natural killer cells, to go out, identify these cells, and destroy them before they can do something that's extremely damaging to the entire organism. Gang, do you have any questions at this time? Okay. All right, then. Let's continue here. We're going to switch topics from defensive cells to defensive proteins. Okay. So this is the next subcategory of number 2, defensive proteins. All right. Within the defensive protein category, we have some topics we need to chat about. The first is going to be the topic of interferon. Interferon, okay? Unfortunately, your book doesn't really give you any pictures or drawings on this, but you can see the bold-faced term interferons on page 242. Okay, so interferon refers to a family of antiviral defense proteins. Again, it's a little bit ironic that, we have a beautiful example happening in the real world at this time of a virus causing a great deal of chaos and distress for humanity. And the reality of it is that anybody that is infected with coronavirus, certainly their body is manufacturing a great deal of interferon at this time in an attempt to defend itself, okay? So interferon is a family of antiviral defense proteins. They are manufactured by cells of the body that have become infected with a virus. Okay, this refers to a family of antiviral defense proteins that are manufactured by cells of the body that have become infected with a virus. In that sense, the purpose of the interferon is to warn neighboring cells in the body that have not yet become infected that, hey, there is an intruder in the body, a virus, and you should do whatever you need to do to try to protect and defend yourself, okay? So think of interferon as a neighbor that's already been burglarized, calling around the neighborhood and warning everyone else that, hey, close your doors, lock your windows, shut your garage doors, because there's a burglar going around, because I was just robbed. Okay? Now, there are a number of things that interferon will actually accomplish for the body. First is interferon warns uninfected cells to defend themselves. Okay? We've mentioned that. The second thing that interferon will do is interferon will actually attract defense cells to their location. In other words, it's kind of like calling the police officers, and the police officers come over to your house and investigate what's going on. Okay, so interferon will attract defensive cells like macrophages to the trouble site of the infection to help solve the problem, to help to defend the body. Okay, so I want to put a question into your notes here, just because I want to be sure that you're still with me and that you're still awake. Okay, and here's the question. Why would a cancer doctor potentially prescribe interferon therapy to his or her cancer patient? That's my question. If you think you know the answer to that, would you please type an answer into the chat window or unmute your microphone? Why would a cancer doctor potentially prescribe interferon therapy to his or her cancer patient? Okay, Kirsten says to prevent the cancer from spreading any further. Well, you might be right about that, Kirsten, but what's the connection here? What I'm saying to you is interferon is an antivirus defensive molecule. Why should it be used to treat cancer? What's the connection between virus and cancer?
Could we say a virus infected the cell will release an interferon causing the nearby cell to heighten their, I don't know, antiviral defenses or something like that? In other words, would they cause, I don't know, I'm trying here.
Okay, Terry, thank you. What you said was not unreasonable, but you didn't quite get to the point yet. Anybody else?
It's 13 hours.
Okay, so let me ask a sub question. Before I answer the main question, let me ask another question. And perhaps I'll put this into the chat window. Please give me an honest yes or no response. Here's the question. Are you aware that viruses can cause cancer? Type yes or no into the chat window. Okay, so we did get a lot of yeses. We did get a no. And so the point here is that some cancers can be caused by virus. Not all cancers. The scientific community does not believe that every cancer is caused by a virus, but we do know that at least some cancers are caused by a virus. So a cancer doctor might decide to treat his or her patient with interferon therapy because the doctor has a suspicion that the patient's cancer was triggered by the presence of an unknown virus in that person's body. Okay. So at least some cancers are known to be caused by virus infection. A cancer doctor may use interferon treatment to help the patient if the doctor is suspicious that a virus may be the cause of the patient's cancer. Okay. All right. So another question coming through the chat window. Okay. Why should preteen girls and boys get a Gardasil vaccination? Why should preteen girls and boys get a Gardasil vaccination? What's the purpose of the Gardasil vaccination? I'm hoping honestly that most of you have had it, but that may not be the case. You've heard of Gardasil, haven't you? Probably seen it in commercials at some point. Why should preteen girls and boys get a Gardasil vaccination? What does the Gardasil vaccination protect you from?
Isn't it from HPV
Okay.
related cancers?
Yes. What's HPV? Do you know?
Unfortunately, no.
Okay. But you did have a good answer there, so thank you very much for that. That's exactly the case, folks. The Gardasil vaccine is to protect, okay, Alexi, to prepare the body to fight the virus. That's true. Okay, the Gardasil vaccine is given typically to young girls to protect them from cervical cancer. Cervical cancer is caused by the HPV virus, the human papilloma virus. As it turns out, not only can that virus cause cervical cancer in girls, it can also cause testicular cancer in boys. And so it really is important that, preteen boys and girls, before they become sexually active, they really should have a Gardasil vaccination to protect against this virus, which is sexually transmitted. Okay? So my point in asking you this question is that you've probably seen a commercial about Gardasil, or at least are aware of Gardasil. The whole purpose of it is to protect against cancers that are caused by the human papilloma virus. Okay, so let me just answer my own question in the chat window. Okay, at first, the whole reason to create the vaccine was to protect the girls from cervical cancer, but more recent research is also showing that it does have a benefit for the boys as well. So if you're a young folk, many of you are young people, you may have had this, and certainly if you have children that are getting older, you may want to think about, getting them the Gardasil shot once we return to a more normal lifestyle. Okay, any questions? Okay, so interferon is one category of defensive protein. A second category of defensive protein is complement. Okay, complement is, the effects of the complement protein are shown to you on figure 13.5 on page 243. Complement represents a different group of proteins which assist or complement the immune system. Okay, so obviously there are a group of proteins that help your immune system defend you. And what they're showing to you in figure 13.5 is just a little bit of what complement protein can actually do. One of the most dramatic things is that the complement protein can bind to certain pathogens like bacteria, cause little holes to form in the cell wall, and all of a sudden the cell wall is weakened enough when water enters the cell overinflates and it bursts like a balloon that's popping. Okay, so let's see here. Let's put in a couple of statements about what complement can do for us. The complement system can bind to pathogenic bacteria and cause them to burst by allowing too much water to enter the cells. Okay, that's really what you see on figure 13.5. In addition to that, the complement protein will attract defense cells to the problem site. Just like interferon can attract defense cells, so can complement. Okay, attract defense cells to the problem location. Complement protein can also act like a bridge between the cell making you sick and the defense cell that wants to attack that cell. For example, in a weird analogy, imagine that last night you went to the grocery store and you purchased $200 worth of groceries and you just filled up your refrigerator. I mean, it's just chock full of stuff. And so imagine that you have all these groceries in your refrigerator and you go to work today, and while you're at work, your mischievous, your troublesome 11-year-old takes out a saw and saws off the door handle to your refrigerator door. Now, I know that's ridiculous, but my whole point is, if somebody cuts off the door handle to your refrigerator door, it's going to be a lot harder to open your door because you can't get a grip on the door. So one thing that happens in the body is that sometimes our defense cells identify a pathogen. They know where it is. They can see it from a chemical perspective, but they can't really attack it properly because they can't get a good grip on it. Well, one way to help the defense cell get a good grip on the pathogen is to have a bridging molecule like complement that can act as a molecular door handle to allow the defense cell to get a good grip on the pathogenic cell and destroy it. So complement can act as a bridge or door handle to help defensive cells grab onto pathogens to destroy them. Okay. And one final thing about the complement system is that complement itself is a chemical trigger to activate inflammation. Okay, now we're going to talk about inflammation next, so I'll just wait a moment to do that. But we know that inflammation, as bad as inflammation can sometimes be, it is meant to be a protective mechanism. It's just that sometimes it goes a little too far and actually causes more harm than good. Okay. So gang, do you have any questions right now? we are still in the second line of defense. We have talked about defensive cells. We have now talked about two major categories of defensive proteins. We're going to go to the third element that is part of the second line of defense. Okay, so this is going to be letter C, which is inflammation. Okay, inflammation is talked about on page 244 of your textbook, figure 13.6. Inflammation is defined as a non-specific response to tissue damage, a non-specific response to tissue injury. And what we mean by that fuzzy word non-specific, okay, this word non-specific, what it means is that if you cut your hand with a knife in the kitchen, or you cut your hand by falling down on the macadam because you trip outside, it doesn't matter what did the damage, your body's still going to respond to the damage in a specific way. So it doesn't matter what caused the damage. Okay, in that sense, it's non-specific. It doesn't matter what did the damage. The body's simply going to respond to help repair the damage, irregardless of what actually caused the damage. Okay, so I'm sure inflammation is something that we've all experienced. And so let me list out the symptoms here. And these are also in your textbook. All right. Now, when you have an inflamed area of your body, think about the last time that you had any inflammation. You know, maybe you had an inflamed hangnail on your finger. Maybe you had an inflamed toenail on your toe. Who knows what it might be? It could have been an inflamed hair follicle someplace on your body after you nicked yourself shaving. Who knows? Okay. Typically, during inflammation, that the area that's inflamed is going to be red, right? You're going to experience redness. The reason you experience redness is because in the area that the inflammation is taking place in, where the tissue is damaged, the blood vessels in that area are going to widen. And the fancy word for widen is dilate. They're going to widen, and that's going to increase the blood flow into the damaged tissue for the purposes of healing the damaged tissue. Okay? So the redness is caused by an increase of blood flow when blood vessels widen, meaning dilate. Okay? The increased blood flow is to help heal the tissue. Okay? In addition to the redness, you're going to feel heat. And heat here is not the same thing as a fever. This is not a fever. What I'm saying is, if you had an inflamed toe on your body and you touched your toe with a finger, just the toe would feel unusually warm. And the reason for that is also because of the increase in blood flow, right? Remember, blood contains plasma. Plasma is made of water. Water is a good temperature buffer. You learned this in the first couple weeks of our course. So the water of the plasma of the blood contains a lot of heat energy. And if we're allowing more blood, a larger volume of blood into that tissue location, you're going to bring more heat energy into that tissue location. So that location is going to feel warmer. Okay? So this is also caused by an increase in blood flow. Well, in addition to heat, there's also a swelling factor here, right? Typically, inflamed areas swell a little bit. And the reason for that is because there's so much blood flow coming into an area due to the blood vessels widening, that when the blood vessels widen, they actually start leaking a little bit of plasma out, right? We talked about that briefly when we talked about the lymphatic circulation in chapter 12. The fact of the matter is that your body leaks plasma out of the bloodstream every time your heart beats in order to deliver that plasma to the lymph nodes to detect for pathogens. It's the same basic idea here. if we overswell or over widen the blood vessels, a little bit of plasma will leak out into the surrounding tissue, and that's what actually causes the sweat. That's what causes the swelling, caused by blood plasma leaking out of the blood vessels when they widen. Okay. Now, the typical excuse for why this happens is, if you damaged your ankle, if you were playing soccer and you overturned your ankle while you were running down the field, you might inflame the ankle and it might swell. And the argument that we make is that the increased fluid in that area will momentarily immobilize the joint so that you can't bend it properly anymore, because the body doesn't want you to bend it. It wants it to stay immobilized so that the tissue can heal itself. Okay, so the swelling is often used to immobilize joints to accelerate healing. Okay, and then the final symptom of inflammation, which we've all experienced, is simply pain. Okay, if you bring a larger volume of blood into an area and you allow that tissue to swell, that's certainly going to bump up into tissue that has nerve endings. So when the tissue swells, the nerves in the tissue that's swelling are going to activate, generate nerve impulses like we talked about in chapter 7, and send that electrical signal to the brain, and you feel it, you perceive it, and you say, ouch, that hurts. Okay, so the pain is caused by the activation of nerve endings in tissue that is swelling. Okay, all right, gang. Now, inflammation does get a fairly bad rap because, typically if you have a sports injury, you overturn your ankle, first thing they're going to do is put an ice pack on it because they want to reduce the inflammation. Reducing the inflammation reduces the pain. But the reality of it is, if you're doing something to reduce the inflammation and the pain, you're going to slow down the repair of the tissue, right? So we're trading off the pain for slower recovery. And that's just how it works. So let's put it this way. Short-term inflammation of a few hours to a few days is generally a beneficial thing to your body. It's helpful. Okay. Short-term inflammation, hours to days, is usually beneficial because it accelerates healing. Long-term inflammation, and I'll define long-term as weeks to months to even years, because that is a possibility. Is detrimental, because usually that indicates that the inflammatory process has become uncontrolled and is kind of overreacting like a runaway freight train on the rails. And in that case, it typically does not accelerate healing. It actually promotes harm to the body. Okay. Now, an example of long-term inflammation would be coronary artery disease. Okay. I'm talking about the buildup and accumulation of plaque inside your blood vessels. Okay. This is something that represents a low level of inflammation that typically works over many, many years to decades to eventually block a blood vessel and potentially cause a heart attack or maybe a stroke. Okay. Typically is associated with low level long-term inflammation. Okay. And that's why it really is important. It's easier said than done, like most things in life. It really is important to try to eat a healthy diet, because if you eat a diet that actually promotes a low level of chronic long-term inflammation in the body, you're definitely doing a very, very slow damage to your blood supply, your blood vessels, and that could have dramatic consequences down the road. It's just that it's so long and so subtle that you often don't realize you're doing it until something really goes haywire in the body, and then you're in the emergency room. Okay, questions, gang? Okay, so inflammation in the short term, a couple hours to a couple days, it's a good thing. It's protective. Over the long term, it will cause damage, and you want to take medicines to shut it down. Okay, so the final thing in the second line of defense is going to be fever. That would be letter D. Okay, fever would be letter D. Fever is also a defensive mechanism that your body uses. Fever refers to an elevation of your body temperature. It is a body-wide elevation in temperature. A body-wide elevation in temperature. Okay? Fever is caused by fever is actually caused by your body's thermostat resetting itself higher. And your body's thermostat is in the hypothalamus of the brain. Okay? So during infection, the cells of your body release molecules into the bloodstream called pyrogens. Okay? These pyrogen molecules reach the cells of the hypothalamus in your brain, and your hypothalamus responds by setting by setting your body thermostat higher, so that your body holds on to more heat energy. So you go from 98.6 degrees Fahrenheit to 102 degrees Fahrenheit, which triggers your hypothalamus to reset your body temperature higher. Okay. Now, I usually like to spend some time trying to draw answers out of students, but I know there's still so much more to do here. Okay. Fever. Let's ask this question: how is fever protective for you? Can anybody answer that either in the chat window or by unmuting your microphone? How is fever protective for you? What does fever do for you? I mean, fever does make you feel bad, right? I mean, I don't know about you, but anytime I'm sick, I can usually function unless I have a fever. If I have a fever, that's it. I'm sitting down, I'm lying down, I'm not doing anything. So how is fever protective for you?
Isn't the whole reason of fever to try and kill off any viruses or bacteria by heating up your body temperature?
Okay.
So just kills them like that?
Is that Silver?
Yes.
Okay, thank you, Silver. Yes, you're exactly right. Remember from the content we talked about during the first weeks of the semester, we mentioned that changes in temperature change the shape of molecules, which change their function. So when you hold on to more heat energy, which is reflective in a fever, the molecules that make up the pathogen that's making you sick will change their shape and hopefully cause the pathogen to die. Basically, you're trying to burn the infection out, okay? The increased heat energy will change the shape of the molecules in the pathogen making you sick. Hopefully that will kill the pathogen. The problem is, as you surmise, is that you can't increase the heat and just impact the pathogen cells. Your own body cells are going to have to endure that excess heat as well, which is why the molecules in your own cells also change shape. They function less efficiently than they would, and that's why you feel really bad when you have a fever. Unfortunately, your own cells have molecules that also change shape, changing their function. So you end up feeling badly with a fever. You end up feeling bad with a fever. Okay. In some ways, it's hard to think of it this way, but in some ways, when you have a fever, Mother Nature is playing a game of chicken in your body. And that game of chicken is this, that both the pathogen is going to experience heat and the cells of your body are going to experience heat. Whichever one dies first, well, if the pathogen dies first, then you win, you recover from the infection. But obviously, if your cells start to die first before the pathogen, you're going to lose that game of chicken and you're going to pass away. So fever is a protective mechanism. And if you're a healthy person, you have no underlying health conditions, then you really should let a low-level fever do its thing. I mean, if you have 101, 102 fever, you really should try to let it alone and don't take any medications to lower the fever, because the fever is actually trying to fight the infection for you so that you feel better quicker. You do have to watch it though, right? Because the fever can become too high too rapidly and actually cause harm. If you start hitting that 104 range, you do want to take action to bring that fever down, because you don't want to damage the nervous system. The nervous system is very, very delicate, and elevated fever can damage the brain and spinal cord. Question coming through the chat window. Okay, what is the Guinness Book of World Records record for the highest fever a person has ever survived?
I'm going to go on a limb here and say 114 degrees.
Okay, thank you very much. You are really, really close. 109, Riley, that's not too bad either. The information that I have available is 115 degrees. Okay, which is absolutely insane. So, it's a possibility that measurement was taking and, represents some sort of error, and it really wasn't that high. But the information that I've seen on that is that there was a documented case of a man that survived a fever of 115. Okay, you do not want to allow your body temperature to get even remotely close to that. You hit 104 degrees, start taking medication to bring that fever down.
Excuse me.
Yes.
The person who survived having 115 degrees Fahrenheit, did he have any side effects after recovering?
Well, that is that's the amazing thing about it. You would expect that a fever that high might have some long-term consequences, but in this particular case, apparently not.
All right, thank you.
Okay, any other questions? Okay, gang, let's keep on going here. So over the past hour, we have covered the first and second lines of defense. And it's only now that I think we're going to really get into the good stuff. which is the third line of defense, which is the immune system. So far, gang, maybe it hasn't been obvious to you, but we have not been talking about your immune system. We've been talking about things that sit outside the immune system. The physical and chemical barriers that are the first line of defense, they are not thought of as part of the immune system. The defensive cells, defensive proteins, inflammation, and fever, while they certainly interact at times with the immune system, we don't typically think of them as the formal immune system. So the third line of defense, which we're going to spend the rest of our time on today and at least part of next class on, is where we need to focus our energies at this time. Okay, so let me see how I'm doing this in my notes here. Okay, number 3 is the third line of defense. Third line of defense is the immune system. Okay, so a couple talking points here. Okay, first off, the immune system is very special and considered different from the first and second lines of defense because it is a specific response. I think I need to spend a little bit more time talking about that. The immune system is so powerful because it represents a system that can respond specifically to a pathogen. Okay, it can respond specifically to a pathogen. Okay. Remember, we said that the first and second lines of defense are non-specific. They do not respond differently to different pathogens. They respond the same way to every threat. They are not specific. Okay. Okay, the first and second lines are non-specific. They do not respond differently to different threats. But the immune system is specific. It does respond differently to different threats. Okay, what makes the immune system so powerful is that it can manufacture a custom weapon to attack a custom or unique enemy. Okay. Okay. The immune system is powerful because it can manufacture a custom weapon to attack different pathogens differently. Okay. So let's see here. I think what I'm going to do, gang, is show you a quick video. It's going to be about a 4.5-minute video at this time on the immune system and a typical immune response. And I want you to see it and think about it and have it in your mind as we're talking about the immune system. So you have this visualization in your own head as we have a conversation about what an immune system response is really about. Okay, so bear with me a moment. I'm going to bring up a YouTube video about the immune system and I'm going to show it to you. Please really try to focus on it. Don't get distracted while you're at the house. Really think about what it's showing you for the next 4.5 minutes. Okay, so here we go. This video is called Our Immune System Pfizer by Cortical Studios. I will send you a link this afternoon to it so that you can watch it again at home. But here we go.
The functioning of the human body is very complex. Our immune system protects the body against intruders, such as bacteria and viruses. The skin is an important protection device of the body against intruders. The protection by the skin can be broken, for example, by a splinter. This way, bacteria are able to intrude in our body. These bacteria are regarded as non-self substances. Our immune system will try to destroy these non-self cells. We call this an inflammatory response. We will now show you what the process of such an inflammatory response is. In our immune system, many cells play a part, among which white blood cells. An important white blood cell is the macrophage. The macrophage recognizes the bacterium as a non-self substance and engulfs it. The bacterium is slowly destroyed in the macrophage until only very small pieces are left. These little pieces of bacterium are made visible on the outside by the macrophage. This way, the other cells of the immune system are able to notice that a bacterium has entered the body. Apart from that, something else is happening. Since the macrophage engulfs the bacterium, it creates inflammatory substances. These substances are called cytokines. Cytokines bind themselves to receptors on cells. Cytokines exactly fit the shape of such a receptor, like a key in a keyhole. In this manner, the cytokine communicates to another cell. For example, a cytokine is able to warn a macrophage from the position of another macrophage that bacteria are near that have to be destroyed. This is an important step in the inflammatory response. At the point of the inflammation, the amount of macrophages then increases in order to destroy the bacteria. The macrophages are, however, not able to destroy all bacteria. The macrophages, therefore, go to the lymph nodes in our body in order to warn other cells of the immune system that an inflammatory response is taking place. These lymph nodes are important with regard to the defense of the body. Lymph nodes are information centers where cells of the immune system meet in order to exchange information. The macrophages that have engulfed bacteria at the point of the inflammation come into contact with T cells in the lymph nodes. B cells are also present there. Both are white blood cells that play an important part in the inflammatory process. T cells recognize the bacterium pieces on the outside of the macrophage. The T cells bind themselves to those pieces of bacterium on the macrophage, and they become active. The B cells also become active. After this activation, the T cells and B cells divide until a large quantity of these cells has come into being. The T cells and B cells go to the spot of the inflammation. At the spot of the inflammation, the T cells help the other inflammatory cells to attack the bacteria as effectively as possible. This way, they help the macrophages to make more cytokines, which are the inflammatory substances. And they attack bacteria in order to destroy them. As soon as all bacteria have been destroyed, the inflammatory response ceases. In case of an autoimmune disease, the self cells and components are being attacked instead of non-self cells. The exact cause of this is unknown. In this situation, the macrophages also make cytokines. The inflammatory response that accordingly follows against the self cells is about equal to the response against the non-self cells, such as bacteria. So, in case of an autoimmune disease, the self cells are being attacked and damaged. There are many self cells that are being created over and over again. Because of this, the inflammation does not stop, but it continues. This is what we call a chronic inflammatory response. At the spot of the chronic inflammation, many cytokines, macrophages, T cells, and B cells are present. The joint activity of these cells and substances causes damage to our body at the location of the inflammation.
Okay, gang. So, first off, let me ask you a question in the chat window. Were you able to see the video okay? Did it come through okay? Good. I'm glad to hear that. All right. All right. So again, I'll send you a link to that through the email this afternoon that I sent out. You can watch it again. But what I want you to do is to have that video as a visualization in your mind as we talk about some finer points of the immune system and the immune response. Okay. All right. So we already have some talking points here about the immune system. Let me mention a couple other things. Within the immune system, there's primarily two major categories of cells. Okay, they are the B lymphocytes. Okay, now B lymphocytes and T lymphocytes, but I'm going to give you some more notes about the B lymphocytes. The B lymphocytes are manufactured in the bone marrow, and they stay in the bone marrow for a sort of training and educational process that the defense cells go through. So the B cells are made in the bone marrow and they stay in the bone marrow for training. The T lymphocytes are also manufactured in the bone marrow, but the T lymphocytes, after they are born, they actually travel to your thymus for their education and training. And if we have time, we may say more about that at another time. Okay. All right. So, questions at this moment? Okay. So, I'm going to start asking a bunch of questions to try to draw some thinking out of you. I know we're getting short on our time together, but we will continue this certainly next class period as well. So here's a question for you. What has to happen for your immune system to protect you? I know that's sort of a general question, and it's meant to intentionally be a little bit philosophical. But if you think about it, for the B and T cells that we've just identified, for the B and T lymphocytes to protect you, what's the first thing they have to be capable of doing? Isn't it true that the first thing they have to be capable of doing is recognizing and identifying the threat? That's the first thing. B and T cells must be able to identify the threat. That's the first thing that has to happen. Okay. Next question. What does it mean for a B cell? B cell is B lymphocyte. I'm saying the same thing. What does it mean for a B cell to identify a threat? What is actually happening? Okay. I mean, if you think about it, if we were together in the classroom and you wanted to identify each other, all you would have to do is move your head around and look at each other. But T cells and B cells, they don't have any eyeballs, so they can't look at the threat. So what do cells have to do in order to identify the threat? Do you have any thoughts on that? What does a B cell have to do to actually identify a threat? Because it does not have an eyeball to actually look at the threat. Okay, let me give you the answer, folks, because I see we're getting long in our time together here. But let me plant this idea and we will continue with it next time. Eileen says when the thread is bound with the receptors. I like that. I like that a lot. I'm basically going to say that a little bit differently. The point I'm trying to get to you is that a B cell and T cell, when it identifies the threat, it has to physically touch the threat. It has to touch it. Okay. In other words, there must be a molecular interaction between a receptor on the surface of a B cell and a molecule on the surface of the pathogen. The B cell must actually touch the threat. There must be a molecular interaction between the receptor present on the surface of the B cell and the molecule on the surface of the pathogen. Okay, keep that idea in your head for the beginning of next class, folks, because we're going to continue our conversation from this point. So I'm sorry I went a little bit over, but before I leave you, do you have any questions? Okay, so let me remind you of a few things, right? Your third lecture exam is going to be a week from this coming Monday. So be sure that you're trying to do your best to stay up with your personal study time. That will be very important. On Monday, we will finish chapter 13. And on Monday, I will release your study guide for lecture exam 3. Also, keep in mind that the second lab exam is not all that far away. That's on May 4th. And the second lab exam will be on the reading of the lab exercises we would have done had we actually been able to be together in person. So I will be giving you a future study guide for lab exam that will emphasize ideas out of the reading that I want you to do. Even though we can't physically do the activities, there's still content there that you can read and understand, and that's where the exam will ask you questions on. So, do you have any questions before we close up for this afternoon? Okay, I'm going to stop sharing here. I'm going to take a mini break about 10 minutes and I will be back online with Zoom here. If any of you need my attention or if you want to chat with me about anything, I will be happy to help you. So I'll see you in about 10 minutes. If you log off, please be safe. Have a good weekend coming up, and I will see you next Monday. So have a good day, folks. Kirsten, is there something that you need help with?